Welcome back to Advancing Healthcare Through Simulation. I'm your host, Lisa George. Today, I'm very excited to welcome Alex Martins and Stacie Woods from Elevate Healthcare. Alex Martins is the National Manager of Sales at Elevate Healthcare, where he specializes in providing advanced medical simulation solutions to healthcare institutions, with a focus on enhancing clinical education through innovative technology. Alex collaborates with educators and administrators to implement effective simulation-based training programs. And Stacie is a passionate healthcare leader committed to advancing patient safety and strategic partnerships that drive meaningful change. As Chief Nursing Officer at Elevate Healthcare, she leads training, education, and consulting initiatives that bridge practice gaps and enhance clinical excellence. With over 25 years of experience in critical care, obstetrics, and simulation-based education, she has developed nationally recognized safety programs and toolkits that reduce harm and improve outcomes. A TeamSteps master trainer and respected industry expert, Stacie is passionate about empowering clinicians and ensuring that every innovation, partnership, and educational initiative contributes to a safer, more effective healthcare system. Alex, Stacie, thank you so much for joining us today on the podcast. We're really excited to hear your insights and your perspectives. I think we'll start off with our first question. From your perspective in the medical simulation industry, what are some of the biggest trends shaping simulation-based healthcare education today?
I'll start, Lisa. Number one, thanks for having us. It's a real privilege to be with you today. At Elevate Healthcare, our mission is clear. We're committed to making the world safer, healthier, and more productive. We know healthcare is very complex right now, and clinicians are constantly asked to perform under pressure, often in critical moments that matter most. And so what we see when we look at trends shaping simulation-based healthcare education today, we want to ensure mission-driven training. We know that's important to learners and clinicians alike, to ensure they're prepared for high-stake moments that define care. Those high-stake moments are in the everyday. The little things are the big things. Realism and efficiency are certainly on the hearts of many, making simulation more immersive as well as more accessible and autonomous, so that training really does mirror real-world practice. Workforce development and retention. This is one of healthcare's evolving challenges that is on the hearts and minds of many. So addressing burnout and competency gaps, those practice gaps, to ensure clinicians stay confident and engaged. And you can't ignore one of the other big trends, which is AI and personalization, using data-driven insights to adapt training, improve performance outcomes, but as well as data mining, so that they're receiving actionable data that they can now do something with to continue to improve care.
Yeah, absolutely. Go ahead, Alex.
Good point, Stacie, and I want to say the same thing. Thank you very much for having us today. I think this is an exciting opportunity to talk about simulation, introduce it to the world that may not be aware of its existence. And so I think that the biggest trends that are shaping simulation-based education today, when it comes to a technology perspective, is thinking about immersive technologies like virtual and augmented reality. These types of technologies that create highly realistic interactive training environments that can enable healthcare programs to extend their reach and support remote or distance learning. Other trends like AI assistance in simulation, which was touched on by Stacie, but AI is enhancing scenario customization within the world of simulation, adaptive learning, and performance feedback. We are integrating AI into ecosystems in areas where they can save time for educators, as well as provide objective evaluations to improve the efficiency of how simulation is done. These are some trends, as well as the world of simulation is driving towards more interdisciplinary team training. So we're thinking about how these different healthcare professions work in their day-to-day job and the requirements for optimizing team performance, team communication, as well as like I've mentioned, developing new remote or hybrid simulations and scenarios or technologies that can expand the reach of a program to reach these remote areas or people that are in less populated regions, so that we can support the standardization of education and simulation across the nation.
I love that, Alex. I agree. Cloud-based and virtual simulation, essentially the mentality of allow training anytime, anywhere, ensuring that there's access when needed, whether proctored or non-proctored.
As well as letting them have multiple attempts, right? So they can practice again, and see on ways they can improve. Absolutely. Sounds like there is a lot that simulation is covering in many of those areas. And certainly AI has come up on previous episodes as well. So it's exciting to hear what's happening out there in the world of simulation. So how have simulation tools and technology evolved in recent years to better support healthcare training?
Yeah, go ahead. You want to take that, Alex, or do you want me to go?
Yeah, I can take it. I can touch on a few of the improvements and innovations that we've seen in our industry over the last 5 or 10 years. There's been a big focus always from the educational perspective on realism and fidelity. So simulation mannequins or simulators now feature advanced sensors, realistic anatomy, and programmable modeled physiological responses to support educators with the technology and accuracy of technology, to enable them to focus more on their job as educators, instructors, and teachers versus technology managers or running equipment. So simulation tools have become much more efficient for educators to operate so that they can still focus on their main objectives. Within this technology, we're seeing data-driven feedback. So lots of cloud connection, the ability for these systems to track interactions and track performance feedback or evaluations of learners, to be able to provide insights to educators about remediation or about competency levels, to help in the future provide more customized learning opportunities or unique learning opportunities or individualized learning opportunities for each student. A big transition that's happened, I'd say, in the last 10 years is the adoption of more portable or mobile technology. In the past, these high technology pieces of equipment like patient simulators have been tethered or require permanent power sources or compressors to run. The technology has advanced so much that all of this tech can fit into the bodies of patient simulators now, really expanding how they can be used in situ in the actual environments that professionals in healthcare do their work. And so we're seeing simulators and simulations happening in all environments now that we've been able to decouple the technology from the power source. So that's just a big improvement in where simulation can happen. And then lastly, in today's world, the integration of AI, of course, we've touched on it a little bit, and machine learning and natural language processing and models. As these things start to develop and be integrated within simulation technology, that is the direction that the simulation industry is going to continue to evolve to collect these insights about how equipment is being used for AI programs to be able to assess the data that is being captured to provide usable, efficient, or objective evaluations back to educators to be able to make them more efficient in what they do.
Yeah, just improve that accuracy of the feedback, right, for those learners and providers. That's fantastic. Stacie, anything to add to that?
Yeah, I would say that one thing that consumers are looking for in learners that we work with is efficiency, as Alex mentioned, but they're also looking for solutions that are scalable. So not that will just meet their need right now from a technology standpoint or simulation-based education standpoint, but one that remains accessible and cost-effective while equipping their learners. We know that realism matters, as Alex said, and having training that can replicate real-life challenges. And what they're using it for is also, how do we track and trend things that are happening in real time, either at the academic or clinical setting, and using these high fidelity scenarios to mirror real clinical workflows so that you're having preparedness and readiness and recognition that can translate to the bedside and ultimately track these trends and build strong systems.
I like that a lot. I feel like that bridges the gap from the educational setting out into clinical for those learners and then adapts to the needs as well. So that's really great to hear. Thank you for your insights on that.
You're welcome.
What would you say are some of the key drivers behind the increasing adoption of simulation in healthcare education?
I was going to touch on that slightly. Some of the drivers for increasing the adoption for simulation in Canada right now are obvious shortages that exist within the healthcare system. The curriculum for most of these healthcare programs has not been redesigned to think about the challenges of today. And there are differences in the healthcare landscape now. There is trends of retiring populations of healthcare professionals, and there are trends of graduation rates not matching those of the expected retirees that are coming in the next few years. And so there's an exacerbated shortage of healthcare professionals, and therefore a need to identify efficiencies in the curriculum or in the learning journey that we can maybe leverage technology to ensure standardization and high quality education that can potentially speed up the learning curve or speed up the curriculum to allow for more nurses, more medical professionals to graduate, and for them to be more competent towards today's challenges and to be more ready to join the workforce and be effective at their job immediately. Due to current curriculums, and they're designed to which builds out success towards certain exams. The curriculum of today is being redesigned to focus on clinical performance and to really acknowledge the knowledge to practice gap that can exist from going from an educational environment to a professional practicing environment. And so the recognition of those trends is really driving educational institutions to recognize the value of simulation, where it can bring efficiencies to their curriculum and to their protocols. And that's leading to larger investments as there's a transformation and a recognition that simulation is an effective modality that can potentially either supplement or replace challenges with clinical placement.
Yeah, absolutely. One of the things that I always like to ask our partners with are, what keeps you up at night? What are the challenges that you're facing? And as we look at healthcare's evolving challenges, I just want to add on a little bit more to what Alex had said. Clinician burnout and retention challenges are very real. They have financial impacts, but also safety impacts to organizations. There was a recent study that looked at 66% of new graduate nurses, they were already experiencing severe burnout. Could be, primarily related to negative workplace conditions. The talent bench isn't as deep as when I started out as a nurse, right? When I started out as a nurse, I had a preceptor who had been on the floor for 30 years. Now you may have a new nurse or a new tech or a new respiratory therapist who's only been practicing for a year. So they don't have that depth, which leads to really this idea of experiential knowledge loss in healthcare. We know that approximately 800,000 registered nurses are likely to leave the field of nursing globally by 2027. And those estimates are probably low, which is concerning. I love that, Alex, that you talked about the gap between theory and practice, because we see a very significant gap between theory learned in nursing school and then applied nursing practice or professional practice, clinical practice in internships from pre-licensure to post-licensure setting. And we really call that the no-do gap. What people know and what they practice are two different things. And then therein lies the harm. So simulation is really technology-enabled training that allows integration and allowance to integrate solutions that scale, streamlining transition from education to practice with evidence-based scenarios that can lend to experiential learning and overall unparalleled realism, which is fantastic.
I want to shift gears now to talk about some best practices in simulation-based education. For those of our viewers or our listeners that are looking to enhance their skills or their program, so to speak. So what would you say are the most critical factors that make a simulation tool or technology truly effective for healthcare education?
Yeah, that is a great question. I think, what I would say probably first and foremost is I want something, and I don't want to minimize this, but we want something that makes sense. Before I got into the simulation industry, I was a customer of simulation companies, which was really cool in being able to kind of translate that, right? So I'm looking for something that is immersive, that accessible, that promotes realism. But I think sometimes things get too complex, and a lot of people who are participating in simulation or running simulation or coordinating simulation, they need to lend simplicity to their workflows. And sometimes we really do make things too complex. So what I love about what we're doing at Elevate Healthcare is we're looking at this from a lens of how do we integrate simulation into daily clinical workflows rather than just a standalone training event, because the data is clear that when you do that, it can lead to a 30% improvement in response times during those critical moments, because it isn't just about training. At the end of the day, it's about saving lives in moments that matter.
Yeah, I would like to add, when it comes to simulation, there's a wide range of modalities that can be considered, something from very high fidelity technology that includes electronics, plastic, as well as software, all the way down to a simple recreation of a wound using, do-it-yourself materials that can exist within a simulation center. And it's really important to be honest and assess that curriculum and the objectives so that there's proper modality matching and there isn't an inappropriate match of technology to what the learning objectives are. And so I think that's a critical role in the team that is thinking about the long-term vision of simulation at these programs, is making sure that you're appropriately selecting technology to be integrated in areas where they're the most impactful. And so I think best practices when it comes to picking simulation tools that are effective, those best practices are leaning heavily on research and repeatable research that validates certain modalities of technology like patient simulators to be used in certain environments that can, at a very high level, recreate the environment that the learning objectives are looking to recreate. And so that's not always the most high-tech piece of equipment, and it's not always the simplest, cheapest, most accessible piece of equipment, but it really comes down to making sure that training objectives are aligned with the equipment used to support that training.
Yeah, I love that. Matching solutions to the reality of practice but understanding, right, the learner's need or the customer's need first. You never want to sell a product, right, that's not going to lend to a solution. We want to lend tools to replicate, I would say, high stakes real world decision making with efficiency, support, and adaptability.
Yeah. Time and a place for the right technology. We have to resist the urge to pick the fanciest, most exciting. There's a place for it, for sure. How can educators and institutions maximize the impact of the simulation tools in their training programs?
I think I would say using high fidelity scenarios or scenarios, right, that mirror real workflows, right? Because again, it's about that preparedness, ensuring there's readiness. I think when you look at it, right, there's sometimes very clear goals for academic facilities versus clinical facilities. And we talk about building strong systems regardless. So how do you incorporate structured debriefing into your everyday in practice and translate that to the simulation lab or vice versa? Understanding how we can track competency growth using AI-driven assessment tools, but also understanding the confidence and psychological safety that learners have or don't have within the environment is something that is a real hot topic right now. Psychological safety, if the learner's in the simulation lab and is fearful or is scared or maybe recently saw something in practice that they're bringing with them, we also do have to address that. So I think when we talk about how to maximize the impact of tools, we do have to realize that they are tools, and we can't forget human factors as well in ensuring that we're aligning training with real world goals, ensuring that we train to include allied health, nursing, and medical professionals together. We like that interdisciplinary collaboration. And so I think that's really important, right? How do we mirror the work we're doing? You don't want to do something in simulation that's not translatable outside of simulation.
Well said, Stacie. A couple comments that I have on how educators are maximizing the impact of their simulation tools. There's a few key things that I think that need to be considered. I mean, we've already touched on making sure that there's alignment in the simulation and the modalities with the curriculum and objectives and outcomes that the course or the scenario is looking to achieve. Stacie mentioned this is to have the opportunity or the structure and protocols to provide a comprehensive pre-brief and debrief. Simulation in general is a metaphor similar to how professional sports is practiced. It's recorded, it's done in its realistic environment, and then afterwards there's a time for the team to come together to chat in a safe environment about performance. And there needs to be a structured, organized protocol for ensuring that that is a safe environment, that's a positive learning opportunity for both the instructors to learn how to give better feedback or to run these debriefing sessions in an optimal way, and for the students to feel comfortable receiving critical feedback that will lead to them improving their performance. So it's very important, like Stacie said, to create a world of psychological safety around how to maximize the impact of simulation. So that means when it comes time to giving feedback and providing constructive criticism, that environment, separate from maybe the intense environment of a scenario being run live to realistically reflect what happens in the real world, there needs to be a safe environment, and the students need to feel psychologically safe to learn and to acknowledge their mistakes, separate from that high performance environment. So it's very critical to structure this type of delivery in a way where students and learners are set up to expect what challenges they may be coming into, so that they feel confident and competent and ready to go into these high stakes scenarios. And then afterwards, there's an environment there where they are comfortable to acknowledge shortcomings or to acknowledge areas where there can be improved efficiencies in processes and take that feedback in a positive, happy way that they can add it to their repertoire instead of feeling judged or called out for doing something wrong. So I think that's extremely important in maximizing the effectiveness of how a simulation tool benefits a certain situation. And like I said, it's very important that they match the modality, which type of technology they're using for certain situations.
Absolutely.
I think you touched on something really interesting and important. I think that there is more recognition around psychological safety as a part of simulation. And Stacie, I'm wondering if you can share your perspective on what you would recommend for educators or simulationists on how you would approach that.
Yeah, that it's a really great question, and I will say that I've spent a lot of time in research doing within healthcare settings, because in healthcare settings you have nurses and physicians and therapists and tech who see things that are very traumatic for them. You have nursing students who may be seeing that in the clinical field. And I think there's something to be said about emotional debriefing about events, as well as actually debriefing within a simulated event. And sometimes we try and put all of that into one, and not always the smartest thing to do. People can't often have, conversations to respond to actions and outcomes until they've processed things we've seen. And sometimes in simulation, it does trigger. It can trigger an event that was meaningful to you, because at the end of the day, students and clinicians, they are humans. They're humans at heart. They may have even had a situation in their personal life, right, where a loved one has experienced something traumatic that's become traumatic for them. And so when we talk about trauma-informed care, there's no reason we can't replicate that idea of being in simulation. And I like to say there's this mentality of commit to sit. When you can commit to sit with your learners and really understand where they're at from a psychological safety before entering into that space, would be really important. And then again, committing to sit after. Also, you can then translate that same mentality to a patient. What does it mean as a patient in a healthcare setting when you're sitting at their level, leaning into them, you're engaged, maybe holding their hand if they're scared and you ask for permission to do that. But there's something really personal when you sit across from someone and have these conversations versus just above them. There are simulation centers and some of our partners that are doing really interesting things in simulation, having these learner essentially bracelets that track heart rate, that can translate cadence of voices, that can then be analyzed and understand how we can improve simulation programs and entering into an environment that is safe so that it's conducive to learning. And then you can translate that to outcomes later.
Oh, that is so interesting. Thank you so much for giving your recommendations in that area. I think we'll have a lot of input, like comments around that.
Oh, I hope so. I hope to hear back for sure.
Well, Stacie and Alex, I want to thank you both for joining me on the podcast today. You've had some wonderful comments and recommendations to share with our listeners and our viewers, and it has been a fantastic conversation.
Thank you, Lisa, for having us. Healthcare is really changing rapidly, and there's nothing more important than preparing clinicians to deliver confidently in the moments that matter. We believe simulation is such a powerful tool for improving patient safety and workforce development. And we want to ensure that we're good partners, ensuring this training is realistic and efficient and impactful. I'm grateful for our discussion today, and we look forward to continuing the conversation in the future.
Yeah, thank you very much, Lisa, for this opportunity. I think any chance for the simulation industry to speak about itself and to let the greater community become aware of how healthcare professionals are training for a safer world tomorrow is a very exciting opportunity. So thank you for having us on today.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.